Are you suffering from dizziness? Any of your friends or family member, they are suffering from dizziness and vertigo, and they are going from ENT to ENT, they have their normal MRI scan, and still they are not able to find, might be they or the doctors, might be the cause of this dizziness. So there is a chance that they might be suffering from the dizziness coming from their neck problem as well. Yes, I am serious about that. You will get to know all about the neck related dizziness in today's video. So let's start today's video. Hello everyone, welcome back to my YouTube channel. This is Dr. Ravi Khamar here. I am from my clinic, Dubai. So I am the spine and joint related specialist physiotherapist as well as dizziness and vertigo specialist physiotherapist. So in today's video, this is the video number 4, the part 4. We're going to understand what kind of the neck problem also can create the dizziness problem. And yes, I'm serious because just let me just ask you one question. How many of you know that your neck problem, or sometimes due to some neck problem also some patients or some persons get dizziness? If you know, okay, just comment below yes, and if you don't know, just comment below the no. So we have idea how many people they are actually watching this video, they have about the knowledge of this thing. So in today's video, we're going to go the depth about how the neck related problem can cause the dizziness. So in today's video, if I tell you in the depth, we're going to understand in the four main headings. So first, we're going to understand what can be the things, how to differentiate the dizziness is coming from the ear origin or from the neck origin. The second part, we're going to understand in the depth what are the possible causes in the neck or might be the pathology or conditions that can create the dizziness problem. The third one, we're going to understand the treatment procedure or what can be the line of the treatment for this kind of cases. And the fourth one and the final one, we're going to understand the progression part, how this kind of patients going to have a recovery. So let's start our first part. So in the first part, as I mentioned, that is how to differentiate between that this dizziness is coming from the ear origin or from the neck pain problem. So this is the work of your doctor or might be the skilled physiotherapist with some test and everything. They can differentiate this dizziness or the origin of this dizziness and vertigo might be from the neck or the ear, and then accordingly they are going to give you the treatment. But as a layman term or as a patient perspective, if you want to understand how to differentiate your dizziness origin might be coming from ear related or neck related, I'll give you a very good example so you can relate. Like a patient usually have a nausea and vomiting feeling. This dizziness and vertigo usually coming from the ear related problem. But at the same time, if you have a dizziness and discomfort, but you're not having any kind of nausea and vomiting, so that is a clear-cut indication. Your dizziness and vertigo origin, it is not from the ear, might be some of the problem in the neck or might be some other causes that is then actually causing your dizziness. So I hope now the criteria is very clear. But these things, it's usually the good physiotherapists can do that, and accordingly then they usually treat you. So let's move to our next part. So in this one, we're going to understand what are the possible causes or the conditions in the neck that might be creating the dizziness. So we're going to understand basically almost around 4 different conditions. So out of that, the first condition, okay, that is some of the words might be technical. So make sure your full attention should be here. So we'll get a lot of knowledge and out of value out of this video. So the first one, that is the VAS. What is this VAS? VAS means vertebral artery syndrome. Now in your neck, from both of the side on your neck, there is one blood vessels which is going, that is called as a vertebral artery, which is carrying the blood, and that this artery or this vessels going into your brain and which is supplying the blood to your back part of your brain. Now usually what happens, there is due to some problem or something, this artery may get compressed, and these compressions this will cause in the less blood circulation reach to your brain, and this will create a dizziness and disoriented symptoms, and sometimes patient also feel the imbalance. This one exactly mimic like the dizziness and vertigo symptoms which is coming from the ear related origin. Okay, so now we're going to move to the next one. What is the next possible causes of this? Next possible cause is this one. Sometime in your neck there is a C1 and C2 spine are there. So it is called as a C1 cervical 1 and cervical 2 vertebra. there is chances because some of the any reason or some of the chronic pathology or disc problem, anything like that, this alignment of this C1 and C2 vertebra might be little bit disturbed, and this little bit disturbance on this alignment sometimes also can be cause of creating a vertigo and dizziness. Now we're going to move to third causes. What might be the third causes related to neck? That is the postural problem. Nowadays we are using too much of gadgets and mobile and everything because of unhealthy posture and sitting habits. But sometimes your posture of the neck, it is not good, and due to improper posture, due to long time, you are sitting in the wrong position, or you are like working in a laptop in the wrong manner, that one causes your neck, normal curvature of the neck, it will change, and usually the neck curvature is supposed to be like that, and now it becomes straight. So it is called as a straightening of the neck, and consequently when you have a straightening of the neck, this can be easily seen in your X-ray or something. That can lead up to your straightening of your cervical spine, and ultimately there is a compression of your artery, as I mentioned in the first cause. It can create ultimately VS, and that causing your dizziness syndrome. And the last one, if you might be suffering from any disc problem, you have a neck pain or something like that since long years, and you are not getting a proper treatment, and that convert into chronic pathology, and this chronic pathology ultimately causing you the change in the posture of the neck, and ultimately causing the stiffness in the cervical spine, and this leads to the compression of again this vertebral artery, and that one causes like ultimate dizziness. So I hope now you clearly understand what kind of the pathology or condition that is related to your neck that also might be causing the dizziness. Now let's move to our third part. So now we are in the third part of this today's video. So let's understand what can be the line of treatment if your dizziness and all these problems coming from the neck. So first of all, that is the work of the good physiotherapist to differentiate what is might be the cause, or what might be the problem you are actually having that causing the dizziness. So they will confirm with some special tests, physical examinations, and then accordingly they will treat you. Mostly 80 to 90% of the people with a good physiotherapy, they usually recovery will be very good. And some of the cases or severe cases might be they have some disc problem or some severe problem. They need, in these cases, sometimes like 10% of the people, they also need a surgical procedure to recover. So I hope now it's very clear how the treatment of this kind of cases usually happens. Now let's move to the last part, that is the progression. So here we now in our last part of today's video, let's understand the progression of the patient who is suffering from the dizziness which is coming from the neck problem. So how this patient usually recover? So there is a wonderful good news I would like to give you. The patients who is actually suffering from a dizziness which is coming from the neck origin, ideally compared to the patients who is having the dizziness and vertigo from the ear related problem and the pathology, they usually recover very faster than that. That I already mentioned that in before the video, there is a video series that we are going on right now. This is the last and final part of the video. That is the fourth part of our vertigo and dizziness series. So if you didn't watch that video, you will understand how the recovery and all related problem which is coming from ear origin, how they usually recover. So compared to that things, these patients usually recover very fast if the dizziness origin is the neck problem. Okay, and usually if I tell you, these patients have to just follow some of the good instructions which is given by the physiotherapist, and their usually recovering process is very faster compared to that one. Now, so as we are actually finishing this video, if you didn't watch our the last video, this is the vertigo and dizziness full series, and that is the last part of this vertigo series we are going to end up, and after that we are going to start the patient usually suffering with the dizziness and vertigo, what kind of the home exercises they are going to follow. That is, we are going to make it part by part and weekly by weekly progression. So if you didn't watch any of this video in our series of vertigo and dizziness, make sure you just see all the video in a sequential manner, because then or there only we are going to understand the proper knowledge we are going to deliver to you. If you feel this video content or something might be helpful in your friends or family to someone, make sure to share this video so we are able to help so many people indirectly. As well as if you feel this video or might be the knowledge of this video adds so much of value, and if you like this video, hit the like button to to make our YouTube Baba happy so they understand we exist on the YouTube, as well as make sure to subscribe to the channel and hit the bell icon. So in the future when we upload any kind of this quality content, you will not miss any of our videos. With that, take care of yourself and we will see you in our next video.